We've all heard a lot about how COVID-19 prompted lockdowns and disruption in hotspots in the province, especially in the Greater Toronto Area. But the pandemic most certainly has not passed smaller and rural communities by, as the current state of emergency makes clear. With us to get a sense of just what this crisis has felt like in their areas, can we welcome, from furthest away to closest to our studio, as is our custom, on Manitoulin Island, not far from Little Current, there's Al MacNevin. He's the mayor of the town of Northeastern Manitoulin and the Islands. In Greater Napanee, just west of Kingston, Ontario, Mayor Marg Isbester. In Trent Hills, Ontario, just northeast of Belleville, municipal councillor Catherine Redden. She's a former three-term mayor of Campbellford and recently retired from the board of the Rural Ontario Institute. And in Collingwood, Ontario, Dr. Jennifer Young. She's a family physician who attends patients in hospital and community practice and is a past president of the Ontario College of Family Physicians. Great to welcome you four from various parts of our province. And I actually don't want to assume that everybody watching this knows where you four are from. So I'm going to start by just having our director, Sheldon Osmond, bring up this map to show that we've really got, I guess, from the French River down, pretty well covered here. Little Current, Manitoulin Island, largest freshwater island in the world, just about 2 hours southwest of Sudbury. And then coming down at the foot of Georgian Bay, there's Collingwood. And then as we go into the eastern part of the province, Trent Hill and Greater Napanee as we move towards Kingston and eventually Ottawa. So that's where you four are. And Marg, why don't you get us started with this? Rural means different things to different people. What does it mean to you?
It not only does it mean different things to different people, Steve, but it also is evolving. So right now I see rural in our area as meaning there's a great sort of community feel. The nice thing about going through this pandemic is there is support from groups, from faith-based and so on, but that's changing a lot in that people are evolving and moving out to our areas. So therefore, rural is also looking for all the amenities that even the more populated areas have. But it's still got a good feel and just as much fear in our area as there are in the urbans.
Catherine Redden, how about you? What does rural mean to you?
Well, I think, as Marg has said, the definition of rural is becoming more blurred. It used to be any area not urban, but we have some great developments now that are growing in leaps and bounds, but it's still that area that's a little less settled, a little less populated, still has good services, and it has that great community spirit where you literally know everyone. If you're not related to them, you know them or you've seen them on the streets. And it's an area that is becoming more of somewhere that everyone else wants to be just because of the lifestyle.
Jennifer Young.
In healthcare, there is the definition of rurality that is called the Ontario Rurality Index. And what it does is combine a combination of population density and distance from your primary healthcare, as well as distance from healthcare that would be more secondary, so more advanced referral services. And to me, it also embodies, because of that relative lack of density, there's also a less density of healthcare professionals. And each healthcare professional in the rural area tends to need to be a generalist. So family doctors in particular play so many different roles because of that less density of specialists. They are in the emerge in the hospital doing OB, long-term care, leadership, and many other of our colleagues, nurses, play those more generalist roles the more rural you get.
Understood. Al MacNevin.
Well, I'd have to agree with a lot of the comments from the other participants, but for us, it's a caring community that has a smattering of agriculture and settlements, villages, and towns. And probably the biggest definition for me is that if you try and find out where you want to go, and instead of giving you a street address and a house number, they'll tell you to drive up until you get before the bridge a mile and then turn left at the old barn, and then you'll find somebody you're looking for. So that's about it.
That is so true. That is so true. I know. Okay, Mayor MacNevin, let me keep it with you, because obviously all of you have heard about what COVID-19 has done to some of the much more populated areas of this province. But I want to give people a better sense about what COVID-19 has meant to much smaller places. Now, yours is an island of, I don't know what, 5,000 permanent residents or something like that. Has COVID-19 been much of a factor at all over the past year?
Oh, for sure. I mean, like the rest of, I guess, the world and communities across Ontario, people are struggling. They're fearful of what this means, and there's a lot of mental health issues for people that are particularly living in vulnerable situations. So. I guess we've had to adapt and learn, but one of the biggest things that's happened is on the island itself, we have 9 municipalities and 7 First Nations, and we often didn't have a real sense of what the impact of each community's reaction to the pandemic has been. So we've formed a collaborative group where we meet with all those parties on a weekly basis, and we try and give an update on what's happening to each other. And we've really learned a lot about the island, even though we've been here for many years, most of us. So it's been, I think, a good thing. It's helped us to come together in a lot of ways.
Okay, Mayor Isbester, what's the COVID-19 situation been like over the past year in your neck of the woods?
Well, it certainly had a great effect on our small business community, which we do have a combination of rural and urban, but a very vibrant downtown, sort of mom and pop sort of stores. But we also have in our outer limits the big box stores. And it's been very, very tough on our small ones to see the large ones be able to stay open. And it's just a constant, when and how and is it safe? I think, too, for any small community, and I'm sure that the other mayors will certainly agree with me, is our people don't sit and listen to any of the politicians at noon on news. They reach out. We get the phone calls. When does this end? Where can I go? Can I go for a walk? So it's good for that. But a good thing that's come out of it is the collaboration between our health services, the municipality, and the people, the faith-based, getting food and so on out. So there has been a great collaboration. We just seem to be able to snap our fingers and everybody's there to help. Of course, socially distance, physically distance, and they have their masks on. But that has been a good thing. Our small businesses are suffering the most, and that has to end.
Councillor Redden, how about in your part of the province?
Well, similar to Marg's, we've got 3 small communities, Campbellford being the largest. So it's had a great impact on our downtown, initially with the closing of all of our stores and our services. But we had a great volunteer effort come together to help serve those that were in their homes without family support. Everyone has done their best. Everyone's wearing masks. We're distancing. We're doing everything we should. But it's either there's no real in between. Either the businesses are able to service and do curbside and provide everything that individuals are looking for, or they're having to close down, go home, and fear that they won't be able to open again. It's a tough time for a small community, and we're doing our best.
All right, Dr. Young, what is your biggest public health concern in your neck of the woods?
So Collingwood is not quite as rural as many of the communities that would call themselves rural in Canada, and I would really speak to the immense healthcare workers in rural communities are paper thin and very fragile, and so taking one of those out of a community can have a very large impact on their ability to offer care. For example, some communities might have just 2 X-ray techs, and so if one gets sick, then that one X-ray tech is on 24/7 for their community all the time. If you have a physician who is one of 5 physicians in a community that looks after all those roles and is sick and not able to work for a couple of weeks, then the burden is super high. An obstetrics nurse who is out could close down the obstetric services of a community. So the need to protect communities that are so fragile from the infection is really acute. And so I would say that the next wave of our priorities would be to make sure that even though there isn't high prevalence in many of these communities, the fragility of that community's healthcare sector is so high that vaccination for the healthcare communities, those healthcare workers, is really a very, very high priority to protect those communities and the healthcare workers within it.
Let me ask Mayor MacNevin a follow-up on that. Anybody got the vaccine yet on the island?
Yes, just about a week ago, the long-term care facility on the Wikwimikong First Nation received the vaccinations from the Moderna, and we've been advised just yesterday that the other two long-term care homes on the island will be receiving theirs by February 5th, so it's good news. They're very in a situation where obviously the spread of the pandemic has been a huge impact on long-term care homes. So we're looking forward to that getting done, and then hopefully we'll see the rest of the phase 1 and 2 roll out soon.
Your Worship, let me follow up again with this. I was on the island last summer and went to a flea market in a town of 100 people, Kagawang. And I was surprised when I went there that there was such adherence to the protocols. Even outdoors on a lovely summer afternoon, everybody had masks on. They were taking people's names and phone numbers as you walked into the flea market in case they had to follow up with contact tracing afterwards. There was no monkey business. And we're talking about a place where, there's maybe been a handful of cases of COVID since this whole thing began. Are you surprised at the amount of adherence to protocols you've seen?
Well, I guess I am. It seems, I guess it's been almost a year, and people that live on Manitoulin, I would have to say the majority have really been cautious. They've been really good at trying to follow the guidelines from public health. And when we get contacted by a lot of our citizens, they have questions, and we try and steer them that way so that they understand it. But it's interesting about a rural area like Manitoulin Island is I'm often surprised when we're all wearing masks and we still can figure out who each other is. It's a miracle, I think.
Well, as was indicated earlier, everybody knows everybody. Marg Isbester, how about to you? Your chief public health concerns at the moment are what?
Certainly the vaccine, getting it, it has been put into our long-term care homes, not so much in my part of KFLNA, which is the Kingston, Frontenac, Lennox, and Addington, but I think actually they start today, and just making sure that we're ready for, God forbid, a third wave. We have to get past this, and the same as my other components on here is small municipalities. Certainly, I think that they keep the rules, they stay by them because they're so visible to everybody. Everybody knows everybody, and everybody is ready to not so much rat people out, but to even say to them, come on, we've got to get through this together. Probably ratting out is part of it as well, but I think that certainly there is a respect for it, and because we support our hospital so much financially as people, not as a government, but as people, that we know the stress that we're putting on, and we know how fortunate, and I'm going to touch every piece of wood that's available to me, that we have not had this monster creep in under the doors of our long-term care. And when I look at what other municipalities are going through, my heart just goes out to them.
Catherine Redden, how much has COVID affected your community so far?
Well, in terms of cases, they've been very few. And we've been very fortunate as well not to have tremendous outbreaks in our nursing homes and our long-term care homes. An outbreak around here is one individual positive. So we've been very, very careful with visiting, with protocols and so on. And our hospital sits right in the center of our community. And as Marg says, rural communities support their hospitals and their healthcare providers. We've actually had parades. We had a tractor parade earlier in the year with our agricultural community just to lift the spirits of our nurses and doctors and the other providers in the hospital, to show them how much we care. We've lit our town with lights. Our Christmas lights in many cases still exist. Signage on the lawns, and deliveries of some of the best donuts you could find up to the individuals in the emergency to keep them going. It's been a long time for them, and very few of us don't know someone working at the hospital or in some of the other clinics. So we were really heartened this week to learn that some doses of vaccine are now available in our area, and we just hope we can hurry that up and take care of our most vulnerable first.
Let me follow that hospital angle with Mayor Al, and that is, I think there's 2 hospitals on Manitoulin Island, and I'm betting that they might, I don't know, 1 or 2 ICU beds in each hospital. How are they managing so far?
Well, it's interesting throughout this pandemic. Like we found out a lot more about healthcare than we ever knew before. So working together with the management team at the hospital, it was identified very early that they have perhaps the capability of 2 ICU beds in each hospital, and would be very quickly overrun if we had an outbreak of any kind on Manitoulin. So in the very beginning, after the first wave struck, we found a way to work with the Manitoulin Health Center to create a field hospital with a 30-bed capacity to help in the event that we had a surge or an outbreak on Manitoulin Island. So the hospital worked with the staff in our municipality in Little Court, but it was a collaborative effort with other communities to create that facility in our recreation center where we have our arena and curling club. And it was the only real building on the island that had separate heating ventilation systems, so that both the patients and the workers, the healthcare providers, would have a safe place to either eat their meals, change into their equipment, and go into the patient area. So that's been ready since early in the pandemic. Hopefully we'll never have to use it. But as Dr. Young said, there's a huge risk with the number of physicians and frontline workers at the hospital that they would be quickly overrun. And as a collaborative effort, we've been able to combine all the healthcare workers across the island to step up to that field hospital should we need it in the event of another surge. So.
Gotcha. Dr. Young, I actually want to ask you a non-medical question, although I'm sure medicine and healthcare come into this in a big way. Broadband has been raised as a huge issue all over rural Ontario. How do you, in your work and in your contacts with people in your area of the province, how is that an issue for you?
Now that so much care is being offered virtually and so much of our lives are being led virtually, it to me is a basic Canadian right, access to excellent broadband internet, especially in rural areas where those distances are even further. And so for our healthcare, for example, we do video calls, and if somebody's not able to connect with us with a good connection, those are really hampered. Phone calls can do the majority of our visits, but there are some interactions such as sensitive counseling, or we can do physical examinations that are not actually hands-on, obviously, but ones that are aided by that good internet connection. Rural areas are doing it virtual ICU, where remote communities can tap into an ICU bed or ICU physicians in communities far away, and that quality of that video means a whole lot to providing excellent care. And then that also obviously extends to education and business. And in order to provide equitable access to these parts of our lives, internet that's excellent needs to be there for all of us.
I don't want to jinx it because it's been pretty good so far. We haven't had any big dropouts, but Mayor Marg, on a typical daily basis, how's the bandwidth where you are?
Well, on a typical day, I'm okay where I am, but certainly we have pockets of our municipality because we are along and sort of north-south. So there are pockets for broadband, which of course we're working on, but we can't work on them nearly enough. And I'm really pleased and a learning process to see how it is with the health system, Doctor. I had not thought about that. It's just another way to press our other governments to get their stuff together and get this broadband out. I thank you for that. I'll pass that on to my Eastern Ontario Wardens Caucus. That's good information that I probably should have thought of. Sorry to take so long.
Now, I bet when you talk to that caucus, you're not going to say, get their stuff together. I bet you're going to say something else.
I was really hoping that I would get stuff out instead of something else.
Okay, Councillor Redden, how about broadband where you are? What's it like?
Well, in the urban areas, it's excellent. And we're able to do a lot of our meetings and Zoom virtual community organizations are having meetings back and forth, but it's the same thing. If you're located outside of town, Northumberland is known for its hills, and if you're on the wrong side of the hill, you just don't get good reception. I actually was involved with a Conservation Authority meeting last week where 4 of our members had to telephone in. They weren't able to do the Zoom, so it is difficult. And just the nature of the membership of many of our organizations. We also have individuals who are older and are not as technically savvy. And so there are a lot of concerns that so many meetings and so many events are being held virtually that they're not able to participate. So we have to address that as well. But I should say that the Eastern Ontario Regional Network, or EORN, is doing great things in pushing both the federal and the provincial governments for funding, and smaller municipalities are definitely looking towards them to get some results. It is becoming as important as a telephone or as electricity to have access to internet.
And Mayor MacNevin, on the island, how's the bandwidth there?
Well, it's a mix of situations. If you're outside of the settlement or village areas, it's difficult. And for our council itself, it's been quite a learning curve. For a lot of people live in the rural parts. We've actually given support to some of our staff and council to help them join those meetings or work from home, including helping with the small tower installations so that they can get connected to different internet providers. But like all rural municipalities, it's a major struggle. And we've been supporting applications by a number of providers to try and get funding through different provincial and federal programs. And we're hoping that as time goes on, we'll see those start to materialize. Like we've heard from a lot of other communities, it's essential today. We can't operate anymore with people not being connected. And it's been very difficult for the children that are at home, often having to work online with 2 or 3 children in the family with no bandwidth, maybe even not enough computers. It's tricky sometimes.
Okay, let's spend some time here on something that we hear a lot about in the big cities, but having you 4 here, you're like a mini focus group where we can actually test whether this is actually happening. Dr. Young, to you first. We are hearing that because of the intensity of COVID-19 in big cities, and of course the price of housing as well, a lot of people have just decided, you know what, enough of the city. I am moving to a less populated part of Ontario, better quality of life, cheaper, farther away from COVID. Are you seeing any signs on the ground that this is actually happening in your neck of the woods?
I can't tell you how many signs on the ground I'm seeing of that happening. First off, many people have winter homes, and they have come since the beginning of the pandemic have come to work from those second homes, and the number of 416 telephone numbers that we have in our emergency room and in our businesses is really increased over the last during the pandemic. The housing market has absolutely exploded, and housing costs are you can't find a house, and when you do find one, I have a friend who's a real estate agent and a realtor, and she has had a 22-way bid on one house most recently. So it's hugely changed this last year.
I guess people who are in are happy that their home prices and values are going up. But I guess if you're trying to get a place, tougher now?
Well, it's hard for people who want to buy their first home to now compete with that Toronto market. I would say it's tough now. If you want to own a house in Collingwood, you almost need a two income household.
Okay, Catherine Redden, how about in Trent Hills? How is it there?
Well, right now, I'm really pleased to say that our construction industry it's booming. We've got at least 2, possibly 3 housing developments underway, geared more to a retirement age, but we've got some condos, single family homes, and in the last year, probably 12 to 15 homes already up and built in Campbellford. And in the outlying areas, we're seeing individuals moving in from the city, deciding to drive in and out of Toronto or Ajax and have their family enjoy a slower pace of life. And we're also seeing a lot of cottage conversions or additions put onto them. Rather than 3-season, they're going to 4-season, and they're choosing to work from here. And that just harkens to our issues around the internet and access for them to stay. And tremendous number of home-based businesses where they're building garages and additions they can work from. So it's booming.
And Mayor Marg in Napanee?
Oh, the same thing, of course. We're right on 401, and certainly between 2 large centers that are military centers within Trenton, CFB Trenton and CFB Kingston. So you are bringing a lot of people into the area that do want to stay here for a lot of reasons, just as Catherine has said, which has put a lot of pressure on supplies, put a lot of pressure on our trades, good pressure. And a lot of pressure on our development services for our municipality, trying to make sure that we get things done. I would think that the same maybe as Trent Hills, we are seeing more of a senior population that's coming here, and the amenities that they want are things that we're going to have to start being able to supply. You know, things are going to have to change. They want to come here because of the safety, but they will be a demanding population for the amenities that they're going to require as well.
Now, Mayor Al, I wouldn't think, given that you're anywhere from a 6 to an 8-hour drive from the 416, I wouldn't think you were much of an option for people who wanted to get away from the city, are you?
Well, it's surprising. I think I'll share what we've already heard from our other participants, but I'll give you an example. Like there's one chap that I met that moved to the island that was capable of working from home and renovated his cottage into a year-round residence. And he worked for a company that had an office in Liberty Village in Toronto with 400 employees. And since the pandemic has started, everyone's been working from home, and they're in a business that they can work in a digital environment. So it turns out that not only are they moving from Toronto to Manitoulin Island and to Collingwood and other places, but now that they can prove that they can reliably do their jobs, some of them are moving back to where they grew up, whether it's in the East Coast or the West Coast, and then they have their weekly meetings or daily meetings. They're all over the country now, and I think that the last year has been a record year for us on Manitoulin in terms of building permits and construction and renovation. You can't buy a stick of lumber on the weekend anymore here without lining up for it. You know, it's very busy, and it will put pressure on the services we provide. They will demand better services than we currently have, and in terms of healthcare, it's obviously a big factor because we ramp up in the summers for visiting population when we have locum doctors, et cetera, but to start providing it year round, we're going to have to look at solutions that give us better.
Councillor Redden, how about the notion of Ontarians who couldn't cross the border and go to the United States as they might have done at some point in the past year? Have you noticed more in-province tourism in your part of the province?
Oh, absolutely. I think there's a new term coming out called over-tourism. And as much as we had it on our wish list to have everybody know where Trent Hills was and all the amenities within it, we had so many individuals come this year that we literally couldn't handle them and had to had to shut down a number of our parks actually and restrict access to others. It was very difficult. We love having people come and see what we have here. But on the other hand, there's a lot of work that we have to do to upgrade the amenities, washrooms, facilities for food, and just having individuals that go in and look after the parks after hours. However, the good thing is now the cottages were fully booked, the campgrounds were booked, and we have people that did a lot of staycations here. And so our locations were busy and in some cases overwhelmed. So that's on our chart for this year and the next few years, is to be able to handle all of that and to keep them coming.
In our last minute here, I should ask Jennifer Young about one of the truly great tourism and recreation spots in the province, and that's Blue Mountain, which is not that far away from where you are right now. It's closed. What do people think about that?
Well, I know the hospital was feeling, and when we had our surge in the second wave, a huge amount of anxiety around the tens of thousands of people that come to our community on the weekends and at the holidays, and from all around Southern Ontario. The volume of people is always a challenge for us, but we manage it and we thrive on it. But if it's also bringing COVID in, it is a huge risk for us. So we were quite nervous. Closing the downhill skiing, a very big part of downhill skiing is the social part. And as we've seen, people are getting sick when they interact socially without masks. And so A, volume of people, and B, in some ways, the nature of the downhill skiing scene makes it hard to do it safely. I know that exercising outside is really important, and we can do that outside of our own doors. I'm sorry for our community that we don't have that source of income but I do feel that it is at the present time the right thing to do, given our restricted resources in our hospital. I'm not sure we could manage a huge surge.
Understood. I want to thank the four of you for spending so much time with us on TVO tonight and giving us a sense of what's going on in your part of the province. Al MacNevin from Manitoulin Island, Marg Isbester from Greater Napanee, Catherine Redden from Trent Hills, Dr. Jennifer Young in Collingwood. Be safe, everybody, and thanks so much again.
Thank you.
Thank you.
Thanks.
Thank you.
Bye.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.